Lizette, let's get to the big story, which stems from some slightly awkward, at least ambiguous moments during the press conference with the Oregon Health Authority yesterday. OHA officials announced they were lifting the state's mask mandate for large outdoor events. And when they said that, reporters asked, okay, what about the indoor mandate? What's the metric for lifting that? And you've been wondering this too. Pat wrote to us, I was talking with a friend recently and they said there is no target in the state of Oregon for when mask mandates will be lifted. Is this true? What if we get to 99% vaccinated? What does the governor or OHA have to say about this? Well, from viewer Pat to OHA Pat, here's Director Pat Allen.
Yeah, so we don't have an exact number, and I want to be clear, it's not like we have an exact number that we're keeping secret within OHA and not telling people.
Okay, so no secret number, and frankly, at this point, no number at all. Galen Etlin was sitting in on that press conference for us, and to be clear, like we knew this. I mean, the OHA had told us this, told our Pat Doris this in a statement before, but yesterday they were kind of questioned about the lack of metrics more in depth than ever, and they talked about it more in depth than ever.
Yeah, and a lot of reporters asked about this because it's something a lot of people want to know. Now that we've heard from public health experts, who are not with the state, that having a metric like this actually helps establish public trust. People want to know why it's there, what the judgment, what the rationale is. Is there any end in sight? And of course, that's really difficult when you don't have a metric to even look at.
Sure.
But interestingly enough, Director Patrick Allen with the Oregon Health Authority said setting a metric like this can damage public trust. So here's that soundbite.
What we're really trying to do is to be careful. You phrase it in terms of giving people a target to shoot for, but we also don't want to create false expectations. We don't want to, set a metric today that looks good today, but a month or two or three or whenever it is from now, all of a sudden turns out to be the wrong metric and we have to change it. And then what people feel, I think, is a sense in some cases of betrayal. That they hit that metric that we thought was the right metric and turned out not to be. And so I think we want to be cautious before we do something like that.
So he really had the opposite take there. Setting the metric could damage public trust. Now, he did go on to say a big reason for the hesitation here is Delta. The variant threw all of us a curveball, and it made old COVID metrics irrelevant, and some of the eased restrictions we saw become restrictions again. They don't want to do that this time.
Okay, got it. Interesting. So we know obviously that masks keep infection rates low. We want to reiterate that. That's a good thing. But a reminder, journalists asked all these questions because the outdoor mask mandate for large events is now no more. OHA announced at yesterday's presser, that was the big headline, that they were dropping that. So, what were the metrics for that decision? They obviously had some yardstick there.
Yeah, they were asked this point blank, and they were pretty vague about it, to be honest, because, they noted Oregon was really one of the only states, the only jurisdictions really in the whole country that had an outdoor mandate like this one. But now they simply said, we're doing better. Transmission is lower outside. 8 out of 10 adults in Oregon are vaccinated, so that helps too. They simply said now seems like the right time to lift the outdoor piece of the mandate. Now, Patrick Allen did give some stats in the beginning of this presser and gave some context.
Recall where we were when the mask regulations were first implemented last summer. Our daily cases were numbering in the 4 digits, and our hospital census was more than double what it is today. We took decisive measures, and as has been the case over the course of the pandemic, Oregonians resoundingly responded. Together, we've managed to turn back the tsunami of new infections that very nearly swamped our healthcare system.
Okay, understood. Turning back the tsunami, a really vivid line there, and definitely good context. So, one final question then on the indoor mask mandate. Did OHA officials give any kind of estimate as to when they think this might end?
That's what everyone wants to know, right? The big question. The problem is nothing specific, only that it will last for a while, likely into the new year. So, gonna have to stick to it. We did learn, though, that OHA's Rules Committee is meeting on December 2nd to discuss the indoor mask mandate. So, hopefully, we'll get a clear idea then.
Okay, we'll be watching for sure. Galen, thank you so much.
You bet.
And just to round this out, by the way, we wanted to know, do other states and or cities have metrics for lifting their indoor mask mandates? And we found out a lot of them do. Not all, but many. This article from Forbes gave some good examples, namely, quote, the city of Chicago, they reported, will only lift its local mask mandate when there are fewer than 200 recorded COVID-19 cases per day versus the 245 it is recording now. on average. It goes on to say the city's health commissioner said Monday it, meaning the mandate, will stay in place for at least another couple of weeks. Another example from KCRA, Sacramento's NBC affiliate, they quote a local official saying our expectation is reaching a case rate of 5 per 100,000 residents would be a good point to end the indoor masking mandate for Sacramento County. Some examples there.